What is PRF? So a lot of times you'll hear terms like PRF or PRP, and what that stands for is platelet-rich fibrin, whereas PRP stands for platelet-rich plasma. Those are two very similar things, and what I like to describe PRF is essentially a more concentrated version of PRP. So this is a process where we draw your blood, we put your blood in a centrifuge, and it separates the plasma component from the red blood cells. The plasma is where all of those nice growth factors live. We can actually inject this plasma into the skin. The most common area that we do this in is the under eyes. The under eye is typically the first spot that we see aging. So even like my 30-year-old patients, when they're like, I just don't know why I'm seeing my skin look a little bit older, it's typically in that under eye area. The nice thing about PRF, you can't overdo it. It is a natural biostimulator. It is putting your own stuff back in your body. So you don't have to worry about it looking unnatural, having to dissolve it. It's a very natural approach versus maybe something like filler if you haven't had a great result with that. With PRF, it's multiple sessions that you're doing. It's rarely ever a one and done type treatment, but we see a lot of success with it in the under eye area. Its main purpose is to stimulate collagen and elastin production. So this again isn't going to be one of those things that you see an overnight difference with. After that second and third session, you're really going to see the benefits of that collagen and elastin. That's going to thicken the under eye skin, help with crepey skin. It actually helps brighten the pigment of the skin as well. So if an under eye area is something that's starting to bother you, PRF is a great place to start. Who is a candidate for PRF? That's the nice thing about PRF treatments. Anybody is a candidate. You can start PRF as early as your 20s if you're starting to see that hollowness or darkness and pigment in the under eyes. And again, you can't overdo it with PRF. I have some patients that come in on a quarterly basis and get PRF injections to their under eyes. I have some that maybe come in once a year for a treatment. So the nice thing about PRF is there's really no risk associated with it looking bad or looking overdone. So PRF is a great option for anyone who is interested in under eye restoration. So at our practice, you have two options when it comes to PRF. One is regular PRF and one is PRF Gel. So how do you know which one is best for you? For someone that just has maybe a little bit of skin laxity or just wants some brightening in their under eyes, regular PRF is going to be the best option for you. For someone that's starting to see some of that hollowness or feeling like they've lost volume in the under eye area, that's when I will recommend PRF Gel. PRF Gel is essentially the same thing as PRF, but I'm actually heating half of it and cooling half of it. That way, when I mix it together, it forms a gel-like substance. This is actually going to give the under eye a little bit of volume, similar to a filler, but not as thick. But so for someone that needs a little bit of volume in the under eye area, I'll definitely start with PRF Gel versus someone that maybe just needs a little bit of brightening or a little bit of enhancement in the skin texture. Then we'll start with just regular PRF.
And you can add PRF treatments if you've even had filler in the past. So if you've had tear trough filler in the past, but you want like a booster or you just want a better result, we can definitely add PRF on top of the tear trough filler that you've already had. What we know is that tear trough filler is kind of out.
Yeah.
It's not, I mean, we talk about trends of 2025, you're not going to see us do a ton of tear trough filler. What you're going to see us do a ton of is PRF. Courtney does an amazing job with PRF in our practice. It's for the patient who starts to see the signs of aging around their eyes. You have a little bit of like crepey skin. You have a little bit of volume loss. We know with traditional fillers that it can look too full under your eyes with the wrong filler. And we've seen it year after year after year. And then we have to dissolve those fillers out. So we know there's a natural progression and sequence of aging to the face, and it starts with volume loss, usually around the eyes. This is where PRF is perfect because we can start to soften around the eyes, but not add that gel filler that we did years ago. You may have a few days of swelling though, so we do tell you to plan for that because it is injected, so you could have a little bit of bruising, but swelling can be anywhere from like 1 or 2 days. And we've had a couple of patients have maybe a week. How can you like mask the swelling? Just wear glasses, just like it's some blue light glasses or just your regular glasses, and the glass will sit right there where the swelling's supposed to be. We want this swelling for the inflammatory response to get the collagen going.